Hello, I'm Dr. David Cathcart. I'm a family practice physician from Heartland Regional Medical Center in St. Joseph, and we're going to talk about chemotherapy drugs and their side effects today. Chemotherapy is essentially chemicals, and these chemicals influence the ability or the cell's ability to either survive or die. They allow it to grow or not to grow. And there's a whole host of different types of chemical agents that will affect a cancer's ability to survive or not. If the cancer survives, unfortunately, you may not. So we want to try and kill the cancer cells. And most of these drugs work by interfering with the cell's ability to replicate itself. But unfortunately, almost all cells in our body replicate themselves, particularly those in the GI tract, the mouth, and the stomach, and the lining of the intestine. Those cells are constantly replicating. Cancer cells, though, generally replicate much faster. So if we can find chemical agents that will affect the cancer cells at a more effectively than they do healthy cells, then that's the kind of chemical agents that we want to use for our cancer chemotherapy drugs. But there's natural chemicals as well. Hormones, for example, can either affect the ability of a cancer to grow or not. For example, estrogen. Estrogen is the female hormone, and for some types of breast cancers that women have, they may have, if they have a lot of estrogen, estrogen tends to fuel the fire, if you will, of the breast cancer. And so in many cases, one of the chemotherapy agents that we give to women that have breast cancer are those types of medications that are chemicals that suppress the body's ability to produce estrogen. There are also chemical agents that we give that tend to teach the immune system to view cancer cells as foreign. So when we talk about chemicals in chemotherapy, the term can be broadly applied to mean various things. But generally what we're talking about is the chemical agents that become drugs that we use to treat cancers most effectively and with the least amount of side effects. This is Dr. Cathcart talking about chemicals and chemotherapy.